Welcome to the Thyroidless Life podcast with me, Dr. Rebecca Warren. I created this podcast because I wanted to empower, educate, and equip women to not only just truly understand thyroid hormones, but understand their bodies and how to get themselves well. This is such a unique podcast because not only am I a doctor that's worked with women all over the world on reclaiming their health, but I've walked that same path as well. If you want more information about what it looks like to work with me, get my free Optimal Lab ebook, get plugged into my amazing Thyroid Inner Circle community, as well as join my newsletter, go to my website, drrebeccawarren.com. It's time for Q&A. I have so many great questions that you guys have submitted that I am not even going to be able to put all of the questions and answers in this episode because it would be such a long episode. I love to do these Q&As because I want to make sure that when you hear things and you see things or you're overwhelmed or frustrated, that you can get the insight from someone that not only has worked with both men and women all over the world, but who has lived within this thyroid world, right? That has been looking at research for over 20 years, that has seen things even within her own body. You know, that my perspective is very unique. And I love that. I hate what happened to me, but I love that I can take my own experience and my passion to be able to help all of you guys. So I'm going to answer some of those questions. If you're like, how do you answer my questions? Make sure that you're part of my email newsletter that I send out. I don't bombard your email. In fact, I don't do enough. I probably should do more. People ask me to send out more stuff, and I'm like, all right, I will. But if you want to kind of stay up to date on episodes and research articles, or want to be able to submit your questions, make sure to go to my website, dr.rebeccawarren.com. I'll add it in the show notes. Join my newsletter. Be plugged in there. So let's go ahead and jump right in. Okay, I'm sitting with a recent diagnosis. And just so you guys know, I read these live. I've gathered all these questions. I'm reading it live so you can know exactly what my first thoughts are, what I know about each and every one of these things. So here's the first one. Okay. I'm sitting with a recent diagnosis of thyroid nodules that are most likely cancerous. The recommendation is total thyroidectomy. I'm wondering if after all you've been through and learned, what would you do if you were given the diagnosis now? I am 50. Woo. Okay, we just started off with a big question. Wow. Okay. What would I do? Would I do something differently? Abso-freaking-lutely. I absolutely would. We have not only more and more research coming out on active surveillance being a serious and safe approach to papillary carcinomas that show no risks, right? Like that are very low risk, which is a majority of thyroid nodules and thyroid papillary carcinomas. We're seeing it come out of Japan. We're seeing it even here. Research being done in the US on active surveillance on not only, if you fit this criteria, again, which is a majority of papillary carcinomas, not everyone, but a majority. But if you fit that criteria, what studies have shown is that you can live your whole life and not have any issues with the thyroid cancer. Or they've also looked at that even if people have to end up doing something about it, like if they end up deciding to do surgery and doesn't change the outcomes, especially when it comes to mortality. And I just, what I find often is because I interact with a lot of people like right after they've had their thyroid removed, is that I think one of the worst things that can happen is to make a decision out of fear and lack of information. And a lot of you guys are doing that and have done that. I did that, right? When you hear the C word, there's this cloudiness, which makes sense because you go into kind of survival mode and into sympathetic, even if I give you the research, you can still feel like naturally, oh my gosh, I might die, because it's the C word. But when it comes to thyroid cancer, that's very, very different. And it's just crazy that you're made to make a decision in this kind of survival state. That's not informed consent. In order to make an informed decision, you need the full benefits and the full risks, right? What is the benefit of having the surgery? What are the risks of having the surgery? What are the benefits of doing active surveillance? What are the risks of active surveillance? And now we have radiofrequency ablation, which allows you to keep your thyroid and go in and kind of target those cells. What are the benefits of that? What are the risks of that? For a lot of you guys, I think this is the thing that just ticks me off about this. Let me not get too angry now, is that a lot of surgeons and endocrinologists are so flippant about the treatment of a thyroidectomy. Like, they don't understand why you would want to consider anything else. Like, why not just get it taken out? Like, you can get on a pill. Like, for a lot of practitioners, there's this idea that it's easy, you get it taken care of right away. Like there's doctors out there that this is it. Even if it's micropapillary carcinomas, even if you don't know. I've had that happen with multiple women I've worked with throughout the years, that before they had their thyroid removed, it was inconclusive, but they're still like, well, just get it removed. And that just pisses me off. That makes me so frustrated, because this is a vital organ. And there aren't studies being done on us long term about quality of life. Like, a lot of these studies that we're looking at is dying, right? But what about quality of life? And this is the crazy thing, though, because, one of my most recent episodes, they did, studies on people with thyroid, issues getting on thyroid meds. And they're like, oh, if you don't feel good, that's all in their head, or they have unrealistic expectations. Now throw a man or a woman that's had their thyroid removed, that have lost this vital organ, that overnight they went from having it to not having it. That is so hard and so major on the body. And so this idea that, like, okay, you have this, just get it taken out. Like, there's no rush. I can tell you this. There is no rush. There are like a small percentage of more of aggressive thyroid cancers, and you can see the signs and symptoms, especially with the growth of the thyroid nodule, the spreading, even calcium levels. Like, there is that smaller percentage that there is an aggressive, and you can see that, and then you can do something about it. But the fact that this nodule has probably been growing for years or decades, like, there's no reason to feel a rush to make this decision. No reason. I mean, for me, I found out, and then I think like a month later, I had mine removed. Like, that's what I would do differently. First, I would stop a moment, and I would get as many opinions, second, third, fourth opinions. Just hear out different practitioners with different backgrounds. What's really interesting is I have one of my coaching clients who, we had this conversation just last week. She had her thyroid removed, and they were trying to decide if she needed radiation. There was no signs that she would need radiation whatsoever. And the conversation went that she went to one of her doctors, and he was pushing it, like, why not do it? Well, the reason why you don't want to do it is because high doses of radiation, if you don't need RAI, then don't do it, because that's radiation on your body, and it can increase your chances of other cancers. And so she went for a second opinion at a cancer center, and right off the bat, that doctor, she said, no, you don't need it. And they sent it to this tumor board, but this doctor was frustrated with her and didn't agree with this second opinion until he realized he knew that doctor, and then felt better about her opinion and was like, oh yeah, no, like, okay, I support that. Just because he knew her, But instead of just taking a step back and looking at her background and her experience and her clinical knowledge, like, no, he had to personally know her to respect her opinion, even though she had all of, the academic and professional, criteria to be respected as the second opinion. And so we got into a deeper conversation on how crazy it is, how different your recommendations are according to your practitioner's background. If you have a practitioner that's up to date on active surveillance, or there's practitioners all over the US that are really passionate about radio frequency ablation, they're staying up to date on the research, and they're doing it, and they're seeing good results. And so they understand, like, oh, maybe, you don't have to get your thyroid cut out, versus a practitioner that's just set in their ways, or just look at certain studies only. Like, so much goes into the opinion you're going to get. And what if you come across a doctor that's just really good at thyroidectomies, and why not do it, versus a practitioner that has a client base, patient base that are doing active surveillance, and they're seeing good results with that. That's going to change your recommendation. So what would I do? Right? Like, now that I shared all of that, I mean, I'm just on the other side, and I hear so many stories. Like, so first of all, if I only had one scan, this is what I would do. And I don't know your situation. I don't know what they're finding. I don't know any of that. But for me, I would want to know how much has the nodule grown. So I would talk to my doctor about active surveillance, right? I would talk to my doctor about, is there any concern about this being in my lymph node? And I wouldn't just ask my doctor about active surveillance. I would ask them, do you know the most up-to-date research coming out of Sloan Kettering about active surveillance? Do you know the most up-to-date research coming out of Japan? Do you know the most up-to-date research that's coming out of, Columbia University's hospital, the Irving Medical Center? And I ask these questions, and what you guys have to understand is, this is your body. This is your life. Once that thyroid is cut out, you are sent on your way, right? This is your life. You have to go in there and be ready to have these conversations and not just be written off, right? I'm asking these questions because I want to know that my doctor knows and understands what is out there. And if at any point I am kind of brushed off or said, no, if the response is to just brush me off, I am not moving forward in that practice. I want to talk with a clinician that can bring his or her background and, give me their thoughts on these studies and on this research. I want to talk to someone that may do radio frequency ablation. I would travel to see, like, hey, I want to keep my thyroid. What is this treatment? Like, do I qualify for this treatment? Do you think I'm a good candidate for this? Like, I'm going to look at all of my options. Now, I'm going to talk to my doctor about, what are the benefits of getting the thyroid removed, but what are my risks? And if the doctor just says there's low risks, okay, that's not the answer though. Like, I need to know the risks. I need to know, if I go into this, what could happen. There's a thyroid podcast that I came across. I think it's like Thyroid Doc. I don't know what it is. Thyroid Doc Thyroid. I don't know. But it's a man whose vocal cords, like the nerves, were damaged. That is a serious risk that you have to understand before you go in there, and you got to know the percentage of this, right? We cannot go in to our medical system and just leave it up for chance. We need to go in informed. And the thing that's crazy is that I've come across, there's two different interviews that I listened to on researchers, two different doctors that do research and see patients. And these two different doctors, right, they are really paving the way for either saving your thyroid or active surveillance or radiofrequency ablation. And both doctors were talking about one, she was a woman, and she was saying, like, how incredible it was that the patients were finding her work, they were reaching out to her, and how a lot of these patients had to share her studies, like her research, with their doctors, and how she thinks, you've got to be well informed. And then this other doctor talked about how you need to understand everything you can about your condition so that you can go in to your doctor's office and have an informed conversation. And, he was like, I know some doctors don't like that, which is crazy. Like, why not? Like, why wouldn't you want to have a conversation with someone so that they can understand? Why not empower someone in their body and in their health to make the best decision for themselves? And so I would not, me personally, jump right away. I would identify the growth. I would identify lymph node nodules. I would identify benefits and risks. And if for me, I had a follicular variant papillary carcinoma. In my case, I would, if I could go back, I would not remove my thyroid. I would not. I would do everything I could to shrink those nodules. I would do everything I could to find out what caused this cascade of events to occur. In my situation, that's what I would do. And the one thing that I think is really interesting is that the stuff that I've come across, like in studies and research that's being done on active surveillance, there isn't any information on the population doing anything to change their health. Like if there's mold or heavy metal, we know there's toxins, we know there's pathogens, we know there's things that can cause thyroid nodule growth. We know that thyroid autoimmunity can increase your chances of thyroid nodules and thyroid cancer. And we know there's different things that can trigger that thyroid autoimmunity. And what I find is really interesting is that, these populations, again, there's no information on them transforming their health. So the idea is essentially that these people have thyroid cancer, they have a thyroid nodule, and they just go back to their regular life and they have no issues. Imagine if you were really getting down to the cause of your dysfunction and dysregulation. And that's what I would do. That's what I would, I pray and I hope that the future of thyroid cancers changes significantly. Because this idea of just losing your thyroid and acting like it's no big deal, that's ridiculous. And so let me tell you this, and the person that submitted the question, is 50 years old. And that, being later, like in age, like older, your chances of a low risk thyroid cancer turning into anything, dangerous, it goes down. So again, I'm working on getting some practitioners that are doing that research. I want to like just how I brought on Dr. Bianco. I'm working on getting some more practitioners on here so that you guys can hear like what I'm telling you. I'm not telling you this to make you feel good. I'm not telling you this based off of nothing. There's research, there's studies, there's doctors just like me, but within the medical system that are preaching the same message. So take your time. Do not be afraid. And of course, if you need someone like myself, a functional practitioner that specializes in this, to walk with you in this, if you're in that position right now, if you need some one-on-one work, I do have a one-on-one coaching program. If there's spots available, that's something you can apply for. If there's not spots, you can have a wait list. I have a healing after thyroidectomy roadmap. That doesn't mean you have to get your thyroid removed. It's if you're in that situation where you're considering that, I have that. You can go to my website, drrebeccawarren.com, and just schedule a free call with my team and see if there's something that, I can help you with your decision-making, wherever you need help. So that was a big bang of a first question because I hate it. I hate so many people. Oh, I had one person that did a consult, this one woman that did a consult with me, and she was literally laying on the bed that you go into for your surgery, and the doctor's like, oh yeah, do you just want to go ahead and just do one side or take both sides out? As she's laying there, like about to go into surgery or, prepping for surgery, like that's not informed. That's just, I could go on and on, but we'll move on to the next question. If you guys have any follow-up questions to that, again, go to my website. You can submit the questions there. Okay. So that's what I would do. I love your podcast about all the things we can do to regulate our nervous system, increase our immune system. One of them was to get sunshine. I'm wondering what to do when you live in a climate that's rainy and cold, cloudy for a lot of the winter, the Northwest. I'll tell you this, you still go outside. Yes, you're not going to get as much like strong lumens from the sun as a, beautiful cloudless day, but you still are getting it. You are still getting it. Okay. And so I think one of the most powerful things, as you know, you listen to that episode, one of the most powerful things you can do is to reconnect with nature. And this is coming from a city girl. So this isn't coming from some outdoorsy girl, right? If I could stay inside at all times, I would. But I say all of this because we're seeing more and more studies on earthing and grounding. We're seeing more and more studies on the effect of sunlight, evening light, midday light on cortisol and melatonin. And what essentially that means is that we are missing, right? Like it's not that the sunshine is going to heal all, but you were meant to have it, and lack of it causes dysregulation. So you're still going to go outside on cloudy days, rainy days, just be, kind of over a shelter. You're just going to have to do more time. So I like to tell my coaching clients and my Thyroid Inner Circle community members, I want them to be outside sunny weather, 20 minutes, 30 minutes. Like that's what I would love for them to do, especially if we're working on adrenal and sleep and cortisol levels. But essentially you can be outside for 10 minutes in the morning, 10 minutes midday, 10 minutes in the evening. If it's cloudy or overcast, I'll push it more to 20 minutes, 25 minutes, just getting out there. And you don't have to just go out there and just stand there, right? You can pray, you can have quiet time, meditate, you can do some exercise, you can walk. Ideally, I love coupling the outside with the barefoot. So for those of you guys in cloudy weather, you're just going to have to do it longer. And then, use an umbrella if it's rainy. I think it's even more just energetic and more beautiful to connect, like earthing and barefoot when it's raining as well. Some really powerful stuff there. So again, just get out there longer on those cloudy days, especially up in the Northwest, and try to do it barefoot if you can. Okay. My endo doctor said that I need to stop taking drinks with caffeine because I have hypothyroid now. Is this true? No. Well, okay. Let me paint you a scenario here. When you go hypothyroid, it disrupts and dysregulates your hypothalamus pituitary adrenal axis. So essentially your adrenals, your cortisol. And that's really important because your thyroid hormones, your hypothalamus pituitary, your adrenals, and your sex hormones all are affecting each other. And when you go hypothyroid, you're stressing that the cortisol. You can have high cortisol, you can have low cortisol. And if you're chronically in that state, then if you're depleted with your cortisol and that cortisol is really, or you have really, really high cortisol, taking in caffeine it's hard. It's a stressor. It's a good stressor. I am a huge proponent of good, organic, mold-free coffee. I love coffee. But if your adrenals are stressed because you have untreated, uncontrolled hypothyroidism, then that's going to make it worse. And some of you guys are like, no, Dr. Becca, you don't understand. I'm so tired. I need coffee to even wake up in the morning. And I'm like, that's not good. That is not good. I mean, coffee, essentially for the women that I work with in my community, is a plus. It is not a dependency. And in fact, I highly recommend that you cycle either do a week without coffee or a week of decaf, Swiss water, non-chemically processed decaf coffee to kind of give your body a rest from the caffeine. But this is the problem though, because I have hypothyroidism now. Well, you shouldn't have hypothyroid, right? Like you're working with a doctor to not be hypothyroid. And this is something I have a problem with because through the years, 10 years, right, of working with men and women all over, and healing begins first in your mind, and the things that are said and thought is a reflection of the mind, right? Like you have to understand that you're not hypothyroid, you have hypothyroidism, right? You have it, which means you can do something about it. And unfortunately, though, the interesting thing about that language within the medical system is that actually a lot of people that go in and, are being told that they have a thyroid issue do remain hypothyroid, even if they get on Synthroid or levothyroxine. They are actually still not optimal on their hormones. So really, they do still continue to have hypothyroidism because the goal is just to put you on a drug and send you on your way, not identify or decrease thyroid antibodies, not identify what triggered it, not even for a lot of doctors, for a lot of you guys, the doctor is not even working on optimizing your levels. You can be on the low end of the range and they said you're good to go, right? So if you have active hypothyroidism, like your thyroid hormones, your free T4, free T3 is low, your TSH is high, then yeah, that's affecting your cortisol, and caffeine can make the problem worse. But if you get those thyroid hormones optimal, like caffeine shouldn't be an issue. Obviously, don't go chugging, 2 pots of coffee a day, but no, that is not the case. But make sure you're not hypothyroid. Know your labs, right? Okay. My T3 is a 2.7 and I am having a hard time losing weight. I'm 6 months postpartum and ideally need to lose about 40 pounds before trying for another baby. How can I lose weight with low T3? Thank you. You won't sustain it. You will not lose weight. And I kind of changed it a little bit. You will not sustain weight loss with low T3. You can starve yourself by going low calorie and running a ton, but you will lose weight in an unhealthy way. And you're 6 months postpartum. Just slow down, right? Your body grew a baby, like literally, like these cells came together. Your body grew a human being, sustained life for 9 to 10 months, then allowed that life to be birthed, and then you sustained it with your body. That is incredible. Not only that, but then you lost this huge kind of plate-sized organ, which is the placenta, and then you bled out for weeks. Like, your body is amazing, and it's only been 6 months. So let's talk about what it looks like to support your body if you are wanting to have babies, after already being pregnant. But let's talk about the importance of those thyroid hormones, okay? Because I work with a lot of women with fertility issues, and I tell them there's many ways that you can go get pregnant even if your body isn't able to, even if your body's giving you the signs that it's depleted or something's wrong. You can get pregnant. You could end up pregnant next month. That's a possibility. But that doesn't mean you're going to be well. That doesn't mean you're going to have a healthy, you feel well during pregnancy, but most importantly, postpartum, because that's where I see the issues. Is that there's a lot of women that get pregnant after miscarrying and being depleted and lacking minerals and iron and protein. They get pregnant and then they have the baby, and everyone within the medical system, your friends and family, they're like, oh, healthy, happy baby. And while you're falling apart internally, and externally, your hair's falling out, you can't lose weight, and most of the time it's written off as just, oh, that's postpartum. No, there's so many of you guys that have suffered or are suffering postpartum because your thyroid hormones are up, because your iron is depleted, because your vitamins are low, your insulin, your blood sugar might be high. Like, there's so much that's written off for women as normal when it's not normal. First things first, suboptimal T3 is not going to be the best body to be getting pregnant. Your recovery is going to be slowed down. Your weight loss resistance, if it's truly weight loss resistance, is either your body needs it right now because you're postpartum, or it's a sign of the hormone imbalances going on there. So first things first, I don't know if this person has a thyroid or doesn't have a thyroid. I'm just going to assume they have a thyroid. We got to figure out why your T3 is going down, because if you get your TSH done, your free T4, your free T3, your reverse T3, and your thyroid antibodies, and let's say your reverse T3 is high. That's why you have a T3 at 2.7. Well, if your reverse T3 is high, then that's telling you your body's stressed. Slow down. What's going on? Your body's going to start converting T4 into more reverse T3 because something is wrong, and you have to identify what's wrong, right? What happens if you have thyroid antibodies? If you have TPO antibodies, thyroglobulin antibodies, and they're destroying your thyroid, pregnancy can sometimes make kind of thyroid issues calm down, but for a lot of women, it makes it worse, especially postpartum, right? So usually, let me give you this quick little timeline. I give there about a year to work on underlying issues. And honestly, in a year, maybe not everything's going to get fixed, but I say a year to work on underlying issues, and then 90 days to prepare for conception. So, a year, do you need a detox? Do you need to, work on your nutrition? Do you need to do these? Do you need to fast and refeed? And then 90 days is just focus on giving your body all the nutrients, minerals, amino acids, omegas. Just like a lot of people wait till they get pregnant to take prenatals. And it's like, well, you've already used up nutrients to like when the baby was conceived, right? So you want to start before then. It takes 90 days to prepare the egg for conception. So that's usually what I recommend. I want women, I don't want women just to get pregnant. I want women to get pregnant and have a good pregnancy, an amazing, powerful, transformative birth, and a good postpartum. And listen, you might cry postpartum. Like postpartum, it's a big deal, right? You change as a woman. You either become a mom for the first time or a mom to 2, 3, 4, 5 kids. It's a big change, right? What happens with our hormones, what happens with spiritually, mentally, that's a big change. You don't need to be suffering through with excessive fatigue. Yes, baby might keep you up at night, but a lot of times I find that a lot of women are fatigued because they're lacking iron. They're lacking, again, B vitamins. So where I would begin if I were you, I would do a few different things. I don't know if you're nursing or not. First of all, get complete wellness panel. I'm going to make sure that, like, what are my nutrient levels, right? Where's my iron? Where's my B12, B12, B9? I have an ebook that you can download that talks about that, right? First of all, I'm going to look at all that. I've done a whole podcast episode on my complete wellness panel breakdown, and I've been doing episodes on breaking down the different kind of lab markers even deeper. So you want to look at that. Like I go into iron and ferritin, go into B12, B9, all of that. Next, I'm gonna look at my hormones. Do you have your menstrual cycle? Are you still nursing? Just because you're nursing and you don't have your menstrual cycle, ladies, remember you can still ovulate. So you can still get pregnant. So be careful if you're trying to avoid that, because you can still ovulate even while you're nursing. I would look at my hormones. I would look to see what's going on with my estradiol, progesterone, testosterone, total free sex hormone binding globulin, and DHEAS. I would test that. If I am cycling, I would test that, 5 to 7 days post ovulation. I'm going to check on that. One really big thing, I cannot stress this enough, is nutrients, right? I really kind of teach a paleo way of eating because saying paleo is very easy. It means you're going to try to eat as close to like how our ancestors ate, protein and fat and good, healthy, complex carbs. But two of the biggest things that I see that women undereat, especially postpartum, is protein and fat. Making sure that your body's well nourished, eating enough calories. I find women over and over again undereat more than overeat. And that for you is probably like shocking because you're like, wait, Dr. Rebecca, I'm trying to lose weight. Well, yeah, you're going to be very resistant to weight loss, real good, healthy weight loss, if you are under eating and essentially telling your body there's a famine because you're restrictive with your calories and, most importantly, restrictive with your protein, which is essential for neurotransmitter health, for lean muscle, for cells, for DNA, essential. So I would look at that there too. Now, I don't know if you don't have a thyroid, then obviously your meds need to be addressed, right? Or if you've been on meds, I have people that have been on thyroid meds for 20 plus years. They've been on it for so long. Then if you are on meds, then something needs to happen with that free T3. Where's your T4 at? Like, is it optimal as well, or is it on the low end of the range? Do you need to tweak your T4 and maybe that'll help get your T3 up, or do you need to go ahead and add T3 there? So I would say give yourself time and understand that your body is amazing and it's remarkable, and that when you identify, what's kind of causing this resistance, your body's going to lose weight. Not only is your body going to lose weight, but your body's going to be primed and ready to conceive. So we need to identify, comorbidities, like especially in your blood work, with your hormones, with your nutrition. And then, if you're on thyroid meds, then making sure that's optimal. So I know I get a lot of questions asked about this. I'm just going to have to do a whole episode on preparation for fertility and conception and postpartum. I'll have to do that. But that's a good place to start. I just want you to change that thought process. You're not going to be as healthy. I want to avoid saying you can't lose weight with low T3 because, again, you can. But remember, my background is always going to be looking at the body as a whole, looking at your hormone health, your nervous system health. So you can lose weight, but it's just not going to be healthy and well. And that's what I want for you. All right. We are going to move on to the next question. Thyroid removal, and how can I prevent weight gain? All right. So the biggest issue, number one, with thyroid removal is that people without a thyroid are treated like people with a thyroid. So your functional ranges first of all, there's medical ranges for your thyroid hormones, and then there's functional ranges. And you have to make sure you have complete labs, and you have to make sure that you're in functional range. And then also, how do you know you're optimal within the functional range is by how you feel. I get so frustrated. I get so many people like, my Healing After Thyroidectomy group. This doesn't happen within my coaching community, the Thyroid Inner Circle, but it tends to happen just online. Someone finds me on Instagram or on Facebook. They'll comment, they'll message, or they'll, leave a post on my, my Healing After Thyroidectomy Facebook group. And they're like, I have all these symptoms, or I can't lose weight, and this is awful. And my first thing is always, do you have complete labs? And if you have complete labs, what are your ranges? Guys, come on. The thyroid gland adapts, right? It increases, it decreases thyroid hormones according to our needs. That's the whole point of TSH, is the brain communicating to the thyroid, right? You've lost that adaptive capability now that the thyroid is gone, and you're put on this one little stagnant pill. You have to step in and do that adaptation that's no longer there. And you can't do that unless you know your thyroid levels, your TSH, free T4, free T3, reverse T3. A lot of times, well, my doctor won't order it. Okay, then leave, order your own labs, find someone else that will order it for you. This is your body. This is your health. Like, they can say no, and now you're the one who has to live with that. You've got to know those levels, and you got to make sure those levels are optimal. And post-thyroidectomy, that means your thyroid meds. People can do fine on T4. I've had people, I did fine the first few years, right? That might mean you need to increase your tyrosine or synthroid or whatever. You might need a natural desiccated thyroid hormone like an Armour Thyroid or NP, right? That's a combo. Or you might need T4, T3 separately. And I like T4, T3 separately because you can tweak each according to your needs. I have women that have come to see me that they try to fast and they try to do keto and they try to do all these things and they're working out 6 days a week and they're not seeing the results they're seeing. They don't have a thyroid and their thyroid hormones are just not optimal. And you guys are beating yourself up. You're using exercise kind of as a punishment, like you're exercising more, or you feel like now you got to do carnivore. Now you got to fast more. You guys are over fasting because of your hormones. And essentially, you're feeling like your body's kind of the issue when in actuality, you just need some extra support. So first things first, get my Optimal Labs ebook at drrebeccawarren.com, or I don't know the direct link. I will put the direct link to the ebook in the show notes so you can go get it. So please make sure that you're getting your complete panel done. And then from there, how can you lose weight? Well, you can become fat adapted. You can increase your protein and fat. You're always going to be better off avoiding seed oils, going into good healthy fats, good healthy proteins, organic where you can. Listen, if you can't do all organic, focus on doing organic meats at a minimum and good healthy fats, and then just eat fruits and veggies, right? Like sometimes we can overcomplicate things, but you just got to start the simple things first because they can have the biggest impact and then you can go deeper. And again, this is what we talk about in my Thyroid Inner Circle community. We did a whole functional nutrition deep dive on this. Join that community, get the information you need, and then when you're having troubles or need to switch things up or whatever, you can ask Q&A. You can upgrade to a one-on-one consult with me at a discounted price. It's set up to help you wherever you're at get to that next season of health. It's an amazing resource. So start there. Start with your labs. All right. Next one. I've had RAI in 2012. I struggled with being hypo ever since. Seems there's no help. Ugh, I hate to hear that. I take 2 grains of Armour. Once I start to increase to get my labs up, my heart rate goes even higher than it does now. I basically have to sit with fatigue. What causes this? Also, my TSHTs pretty much is completely suppressed. So you know what doctors do is they lower me to 60 milligrams to get it a tad up. Then here I go again on this merry-go-round. How can I find someone to help me? I'm 44 but feel 94. I can help you. Go to my website. Make a call. If you look at all my services and you don't know which one's the best one for you, get on a call with my team. We'll point you to the right direction. Free call, right? But let me go ahead and say this, right? Because I had just looked at this other question. I'm going to go ahead and add this other question as well. Because this other question says, I have on 2 occasions tried combo therapy, once a few years ago before my thyroidectomy and once since. Total thyroidectomy was 2 years ago. Both times I felt hyper. Synthroid and lyrotheanine, and I stopped the T3 pretty quickly. Before the second time, my doctor had lowered my synthroid to 125 micrograms, and I had every hypo symptom in the book. It was awful, and my hormone levels reflected it. But he loved my TSH where it was. I told him I was miserable, so he started me on T3 again for the second time, and I went hyper. Okay, 2 different people asking pretty much the same question, which means there's a ton of you guys that are going through the same issue. Now, let me give you a little disclaimer. I do not prescribe medication. I have multiple nurse practitioners that I work with. So if you need a nurse practitioner, even if you're in a different state and you're working with me, I have someone for you, right? So that being said, though, I have 20 years experience with meds, med research, and the commentary within the medical system about the different types of thyroid meds. I've also worked with lots of post-thyroidectomy people. Number one, okay, let me go ahead. I'm going to go down the list of all the possibilities as to why you feel like you can't optimize this. Remember, I don't know where you guys are at. I don't know what your levels are, right? This is a situation, and let me go ahead and point this out. You need to, all of you, whether you have your thyroid or had your thyroid removed, you need to go and request all of your medical records from all of your practitioners, have copies of it, and keep it in a binder. This is your body, right? You need to have that. Now, an interesting thing is that when you are thinking about these scenarios, this is how you need to look at it now, okay? When you are thinking to yourself, and this is what I like to do is get your labs and then write how you felt during that lab period, what you experienced and all of that. So what I would do is okay, first of all, what were my levels? What was my T4, my T3, and my reverse T3 when I was feeling hypo, okay? And then what were my levels at when I started to increase? Where did I feel good? Where did I feel a change in symptoms? And then where did I feel hyper? Because you want to know, what your labs look like when you were feeling, experiencing these symptoms, okay? You want to kind of identify that because you shouldn't go up on, again, guys, don't make these changes without talking to your, prescribing practitioner. But what I've seen is that it's not a good idea to go higher on your meds when you're having those symptoms because those hyper symptoms due to meds is dangerous. But this is where your complete wellness labs come in. Thyroid conversion, the resistance to thyroid conversion, reverse T3, your hormones aren't in this little encapsulated areas. There are things that will affect, right? Co-morbidities that will affect your resistance to being able to get on enough thyroid hormones. Iron, anemia, so iron, ferritin, anemia because of B vitamins, insulin resistance. And let me go ahead and tell you this. I'm not talking about just high A1C. I'm talking about your A1C can look good, your fasting glucose can look good, and your insulin is through the roof. There are issues, lack of minerals, lack of selenium, lack of glutathione. There are things, high inflammation, if your C-reactive, protein is high. There are things that you have going on along with this whole, thyroidectomy. Listen, your body, your thyroid just doesn't get sick or have issues just because. It happens in a sick, dysregulated body. So if you've had your thyroid removed, there is something else going on there that doesn't automatically get fixed just because you've had your thyroid removed, right? That's important to understand. You will never feel good on higher dosages of thyroid meds if you are depleted in iron and ferritin and B vitamins. Again, a lot of, my optimal wellness panel that I talk about. Another big one is cortisol. Dysregulated cortisol, dysregulated HPA axis and it kind of goes one causes the other one to get worse and the other one causes it back to get worse. So when you go hypothyroid, you release all this cortisol. And if you've released cortisol for a really long time, you can see a crash in cortisol. And cortisol is a big issue. And the best way to test for cortisol is not just on blood work and not in the morning. I have people bring in labs and they're like, oh, look, I tested my cortisol and it's an AM reading. You have to do a cortisol awakening response test, which is a saliva test that's done over a 24-hour period. And I'm going to put a link for that in the show notes that you can order and get done. You're not going to get that at your medical doctor's office. You're just not. But let me go ahead and tell you this. Usually how I utilize the CAR test is I will have someone work with whoever's prescribing their meds to get to a level that's decent, right? Before they feel not great, increasing, right? Where they're decent on this amount of thyroid meds. Then at that point, I will test cortisol. Then we will work on whatever's happening there, whatever dysregulation is happening there, within the HPA axis, the communication of your brain to those adrenals, and how you're kind of, what stressors are causing this dysregulation. We love on the adrenals, we love on the system. And then once we see a rebalance in that system, then I can see people now work on optimizing their thyroid meds even more. So the idea is there something else there that's causing a resistance to your ability to optimize your thyroid meds? Some of you guys are going through perimenopause and menopause, and it's so dysregulated. And a lot of you guys are like, oh, does that mean I need to be on hormone replacement or bioidentical? That's not what I'm saying necessarily. What I'm saying is, I just talked about the adrenals. When you go into perimenopause and menopause, your body's fully reliant on the adrenals for all of your sex hormones. And when you go into perimenopause, a lot of you guys have had estrogen dominant issues like cysts and fibroids and, history of, hormone-based cancers in your family. And then when you go into perimenopause, it makes those dominance issues even worse, right? You can have depletion of estrogen. So when you get to that point, you got to take a step back and realize what's going on here. Now, the TSH suppression conversation, I see another question here about TSH suppression that I'm going to add in, and it says, so let's talk about that TSH, because that's also going to be an interesting conversation. And this question says, Dr. Bianco, he said the studies about the risks of having a suppressed TSH didn't include free T3 or free T4 levels, and yet he still maintained that TSH is important to take into account. I'm unclear why, given the lack of evidence. Did I miss it? I like how some other thyroid list people feel horrid when my TSH is in the clinical normal range. Okay, you did not miss it. And that's why I specifically asked, do these studies show free T4, free T3? Dr. Bianco is a researcher. He has a significant science background, and I understand, because right now all he has to go off of is what's there and what's been done, and it hasn't been done correctly. So he's gonna, kind of work on the side of caution. And I will say this, I think it was in the episode, or maybe it was before we started recording, right from the beginning, I let him know, like, I don't have a thyroid. I work with many, many people that don't have a thyroid. And I always want to go back to, his information and kind of tying that in for those of us without a thyroid. And he said he's just not super familiar with it. Like, it's not something that he does his research in, and it's not something that he has a lot of background in. So, that's something to take into consideration. And I understand it's frustrating, because I do, and in the both questions that were asked previously about like kind of finding the right combination is TSH. Well, let's not go off of that. What's your free T4? What's your free T3? And what's your reverse T3? And that's why it's important when you have a prescribing practitioner that they're open to hearing you out and working with you. One of them, it seems like they are. So one thing I did find from talking with Dr. Bianco is that, in identifying, this is what we discussed, in identifying that there is an issue, like at the beginning, TSH can be a really, really important marker, but in treating it's not necessarily, okay? So I can't give you a research study. I can't right now say, this is why post-thyroidectomy, so many people feel good on suppressed TSH, like under a 0.5. I cannot tell you that. All I can give you is these little case studies, these, stories of women and men over and over again having free T3 that's not out of range, that is, really well within their ranges, functional ranges and still within medical ranges, having a TSH that is suppressed and they feel great. And I think in the end, I always preach this. I love studies and I love research, but in the end, everything's not black and white. Our bodies, what we've gone through, our family history, we're such unique individuals. And I think it's really important to honor and trust your body, listen to those symptoms, or listen to when you do feel fantastic and you have the best, most optimized health. Our body is not stupid. It's not a broken down machine. And when you find yourself feeling better and you're getting up and you don't have brain fog and you have energy and you're happy and you're not feeling more anxious, like your digestive system feels good, you need to go off of that, right? I love testing. Oh my gosh, I love doing gut tests and Dutch tests. But is it going to give me everything I need to know? Absolutely not. And that's why I think it's really important to listen and to honor your body and to listen what it has to say. And if you feel horrid, like horrible on a TSH that your doctor says you should be at, personally me, I never just stayed there. I wanted the best health possible, not just how I felt, but I wanted to know that my body was optimal, it was healing and functioning well. So the TSH suppression situation, especially post-thyroidectomy, it's just not being done. We don't have the whys for why that is, but I can tell you this: you lost a vital organ overnight, or over a day, or over a couple of hours. There's nothing normal about that, so it makes sense that it's going to be very, very different than someone with a thyroid. So trust and listen to your body. But going back again, you want to make sure that if you're finding resistance to being able to increase your thyroid meds, it's time to pause a moment and look at your overall health. Look at what else is going on. What else do you have a history in? Have you had a history of menstrual cycles? Did you have a hysterectomy? Have you had a gallbladder? Because wherever that kind of history of issues is, it's probably the same reason why you're resistant to being able to increase your thyroid meds and also your cortisol. Your cortisol, very, very important. So instead of just going and trying to push through on increasing your meds, take that into consideration. And another thing, you might do better on a cleaner version of T4. Listen, there's also Tyrosint, which is going to be no fillers. It's a gel capsule. Some of you guys might do fine on T4 if it's easily absorbable. So maybe you don't necessarily need T3. Guys, I am not set on saying NDT, T3, only. Like, I am not. I honor that we are such unique bodies and we're bio individuals. And so what our bodies may need can be very, very different, you versus me. And I think we just got to be open to that. And also we got to have a practitioner that's open to that. So if you're finding that resistance, look at those comorbidities, especially you can start very easily with your complete wellness panel. Get those things under control that's on there, and then see how you do. See if you can increase it. If not, then go to your cortisol and get that taken care of. Or understanding what's going on with your perimenopause or your menopause. Really, really important. I do see that. I see that. I don't see it a ton, but I do see it some. And when I see that resistance, I take a step back and I look at what else is going on. Remember, your body is a complete, intricate system that interacts with each other. And again, if you guys have any follow-up questions, you can submit it in my, question box. You can join my Thyroid Inner Circle community to get more help on your specific situation as well. All right, we have our last question here. Oh, here, before I go on to my last question, there was a follow-up question. How can I try combo therapy without going hypo? Did I need to lower my Synthroid dose more before starting T3? There is no standard formula, because they ask, is there a standard formula? So I can't tell you, because I'm not your prescribing practitioner. But yeah, ideally, if you're going to utilize T3, you can't have tons of T4 and a good amount of T3. That's going to be a lot. And the thing to take into consideration is the only way to know kind of like a baseline like where you're at with your T4 is to wait those 5 to 6 weeks before you start, like you got to know that baseline. So in your situation, you may have needed to decrease that T4 more in order to introduce T3. But I mean, do you do well on, like, are you converting T4 well? Because if you are, then maybe you only need T4. Maybe if you increase that T4 a little bit more, see what happens with your T3. You can get it into optimal ranges without needing T3 and you feel good, that's also an option. So there is no standard formula. You just got to be able to tweak it and then retest and track your symptoms and how you're feeling and what improves and what doesn't improve. But yes, there is a big possibility that T4 may have needed to come down more. That's why it's really good to have those labs over time. Like, this is where it was 5 weeks ago. This is where it's at now. This is where it was 2 months ago, so that you can track that. Like, oh, wait, maybe my T4 is too high. Let me go talk to my doctor about this, about what I'm finding. So really important. Okay, is there a way to test for the T3 polymorphism? The D2, that says, oh, T3, I understand what you're saying. It's a D2, it's the deadenase polymorphism, but because it affects your ability to convert T4 to T3. So, no. Well, Dr. Bianca, this is what he does. He essentially says that there's no point like in testing it right now, because there's so many different factors. Like, you can have the polymorphism, but it doesn't mean that's going to cause an issue. He did say he saw it causing issues more in kind of ethnic groups versus non-ethnic groups. So essentially, just because you have it doesn't mean it's going to be a problem. How do you know then? Then you test your T4 to T3. That's why complete labs are really, really important. If you see that your T4 is on the higher end of the range and that T3 is not budging, that's a big red flag, right? That you might have this. And then the question goes on, are there natural forms of separate T4 and T3 so that they can be better tailored to each other? Yeah, that's why I like compounding pharmacies, because compounding pharmacies allow you to tweak your meds according to you. And that's why I also like T4, T3 combo over NDT, because I do personally, for me, I do compounded and T4, T3 separately. So I can do Tyrosine, which is a gel capsule, and then I do, my T3 separately, because that's what works for me. But I've tried it all. I've been on Armour, and I did great on Armour for 5 years. But that's why I do like either compounding T4 and T3 according to your needs, or I do like that T4, T3 option because you can tweak it according to your needs. Now, do you know any roughly 14-year-olds taking Armour Thyroid? When I first started practicing, I didn't see very many kids. I didn't get a lot of requests for kids. I will say in the last 5 years, I've met with 12-year-olds. I've met with teenagers. I think 12 or 10 is the youngest I've worked with. And that just sucks. It breaks my heart, but I'm seeing it more because anyone with a thyroid can have an issue. It's no longer just a family thing or genetic thing. Like, this environment is just so toxic. And do I know? Yeah, I know of thyroid issues. I don't know if they were taking Armour Thyroid. They came to see me because they wanted help with figuring out how they can rebalance their thyroid hormones and the thyroid glands. So, post-thyroidectomy kids, it is increasing. I'm seeing that increase. So, Armour Thyroid's been around for a while. People feel good on it. But again, I've shared why I like the T4, T3 combo myself. So that's my response to that. That's today's episode. That was a lot of information. I'm going to do another one on the other questions that you guys have been submitting. And of course, if you want me to go deeper on any topic or anything like that, just make sure to submit in my newsletter question link, And I want to be able to provide that information for you guys. Of course, check out all my services and see how we can help you on your thyroid hormone, sex hormone, overall health journey. If you've enjoyed today's episode, please make sure to leave a 5-star review. I love being able to see and read how this information is helping you on your health journey. And make sure to subscribe to the podcast. That way, when new episodes are live, you can have it automatically downloaded to wherever you listen to your podcast. The number one question I get asked is, how do I work with you? If you are interested in finding out more information about me and being a part of my community, go to my website, drrebeccawarren.com. That's dr.rebeccawarren.com. And you should be able to find the answer to your questions there, as well as checking out my Thyroid Inner Circle membership group, getting access to the free Thyroid Labs ebook that I have available for you, and so much more great information.